Uterine cancer. Uterine cancer, also known as endometrial cancer, is a type of cancer that affects the uterus, the organ where a fertilized egg implants and grows into a fetus during pregnancy. Uterine cancer, also known as endometrial cancer, typically begins in the endometrium, which is the lining of the uterus. The endometrium is the part of the uterus that thickens and sheds each month during a woman's menstrual cycle, and it is also where a fertilized egg implants and grows into a fetus during pregnancy. In some cases, uterine cancer may also start in the muscle tissue of the uterus, which is called sarcoma uteri. However, the most common type of uterine cancer, accounting for about 95% of cases, is endometrial cancer that begins in the endometrium. Symptoms of uterine cancer. The most common symptom of uterine cancer is abnormal vaginal bleeding, which includes bleeding between periods or after menopause, heavy or prolonged periods, bleeding or spotting during or after sexual intercourse, watery or bloody discharge from the vagina. Other less common symptoms of uterine cancer may include pelvic pain or pressure, pain during intercourse, abdominal swelling or bloating, loss of appetite or unintentional weight loss, fatigue or weakness. It is important to note that these symptoms may also be caused by other conditions. If you experience any of these symptoms, especially if they persist or worsen over time, it is important to seek medical attention to rule out the possibility of cancer. Risk factors for uterine cancer. There are several risk factors that can increase the likelihood of developing uterine cancer, including age. Uterine cancer is most commonly diagnosed in women over 50 years of age. Obesity. Being overweight or obese increases the risk of developing uterine cancer, as it causes higher levels of estrogen to circulate in the body. Estrogen therapy. Women who take estrogen without progesterone for menopausal symptoms are at an increased risk of developing uterine cancer. Early onset of menstruation. Women who started menstruating at a young age are at a higher risk of developing uterine cancer. Late onset of menopause. Women who go through menopause later in life are at an increased risk of developing uterine cancer. History of endometrial hyperplasia. This is a precancerous condition that can increase the risk of developing uterine cancer. Family history. Women who have a first-degree relative, such as a mother, sister, or daughter, who has had uterine cancer are at an increased risk of developing the disease. Diabetes. Women with diabetes have a higher risk of developing uterine cancer. Having one or more of these risk factors does not necessarily mean that a woman will develop uterine cancer, and some women who do not have any of these risk factors may still develop the disease. Early detection and treatment can improve the chances of a successful recovery from uterine cancer, so it is important to consult with a healthcare provider if you experience any concerning symptoms. Treatment for uterine cancer typically involves surgery to remove the uterus, fallopian tubes, and ovaries, as well as any nearby lymph nodes. Radiation therapy and chemotherapy may also be used to kill any remaining cancer cells. Thank you for watching. Subscribe for more videos.